I'm Susan Cordts, the CEO of Catalytic Health Partners. Well, the health triangle is extremely important to us. We focus on the social, behavioral, and physical medicine needs of individuals, understanding that if people are not socially stable first, in other words, their basic needs are met, they have housing, utilities, food, then they can't worry about other things. And if we're not behaviorally stable and have the support that we need, we're not able to engage at the level that is necessary to make changes in our physical health. So when we take care of the first two, a lot of our physical medicine needs are already taken care of because we've greatly reduced the stress, which often leads to some of the other physical ailments of our individuals. We truly take it to heart that we're going to help our members achieve their goals, and so we don't just give them another list of resources or push them in a direction. We truly sit down, understand their personal goals, understand their needs, and make sure those needs are met. And we carry that all the way through. So it's all components of the health triangle and really being there to be their partner in success. So a lot of people take the approach that we'll give you a bunch of resources and you can go figure it out. We don't take that approach at all. We are really an integrated house call provider program that is social, behavioral, and physical medicine that manages an entire population, irrespective of what their illness is or where they're at in life, in their home environment, making huge differences in their lives and in their healthcare outcomes as well as in the cost of healthcare. Well, a lot has changed over time. Obviously, as every business, when you first start out, you have a dream and an idea, but that doesn't always turn out that way. So we've had to make a lot of modifications to the model. Our team has been unbelievable in terms of their insights and the way they've been able to engage with our members and what they've taught me and all of us about what it really takes to make the difference that we seek to make in people's lives. What hasn't changed is our mission and our vision, which is really to change the healthcare outcomes for our members and help them through the healthcare triangle and truly achieving those goals. Well, I'd say the greatest lessons learned is we started out knowing how important it was to see individuals in their home and to really engage with them in their own environment. However, I think that the true impact you can make could never have been outguessed from what has truly come to reality. And that has been very rewarding and exciting to see. I think the relationship and the engagement that they have with our team and the way that it builds the trust and confidence so that we're able to help them to achieve the other relationships that they need to have with other aspects of the community, whether that be their providers or other resources, to truly make our changes be sustainable and them to be able to be more self-sufficient on their own. We don't want to do anything if we're not changing somebody's life for the positive. In our mind, that is not us telling the individual what the positive is, but for them to discern for themselves. What is it they want to do? What are they wishing for? And how do we help them chart a path to do that? And if you're not saving money in the process, then there's no way to keep it going forward. It wouldn't be sustainable. I'd say really creating a better community and a stronger community with rising everybody up at the same time. One big initiative that we focus on is food insecurity and trying to help identify ways for our members to more consistently have food and for the community to have access to food. And it's not just any food, it's really healthier foods that are contributing to their health and not taking away from that. But additionally, working with our members on how to create more sustainable housing and how to really make that a reality. We started out with this app and we continue to work to improve the app and to improve the opportunities and leveraging that through our tablet. And we still have a ways to go. We learn every day more things that we could do, and we really have a big initiative in front of us right now to involve that even further. We use data a lot, and that really keeps us ahead of where we're at every day. So that's very beneficial to really be able to understand as we're going how we're making a difference and where we're not making a difference so that we can help our members as we go to see what their other opportunities might be. I tell you, I never even dreamed that I would be here today when I first began in nursing more than 35 years ago, as that is to say. It never dreamed it would look anything like this. To be honest, I thought I would work in the hospital and maybe move up within the hospital system, but never had a dream that I would go out and start my own company and do other things. In nursing school, certainly back when I went to nursing school, you weren't taught to think anything outside of the box. You looked at the box and it was the box, but honestly, the sky is the limit. You can create anything you wish to create and make anything you want to make out of it. And healthcare is what we dream it to be and what we decide to make it to be. I think, for a long time as healthcare providers, we have always thought that it looks like the box and that we do what everybody else has done, but that you really can make it to be what you want it to be in the environment you wish it to be. We'll be through the entire state of Arizona by the end of 2019 and looking into going into some other states. So we're already begun that process now, so we're very excited about that prospect. We hope to be in several states by that time, making a difference in, many thousands of lives at a time. So that'll be exciting to see. Well, in my mind, I believe that Catalytic Health Partners honestly allows healthcare providers to do what we always went to school to do and to live out the dream that we always had, that we'd be able to spend time with our members, learn about our members, engage with them in a way to truly make the difference in their life and their outcomes that we wanted to and that they wanted us to. I think we do very meaningful work. We have an awesome team that is very supportive and very engaging to help others grow and learn our process and to continue to make that difference, to truly make a difference in people's lives, to make the difference you dreamed you were going to be able to make.